Bridging Past and Present, Combating Inequities in U.S. Healthcare and Workers' Compensation. The dark shadow of the Nazis Aktion T4 program, which targeted the disabled and marginalized for eugenics, lingers as a grim reminder of the consequences of systemic discrimination. Today, parallels can be drawn with the treatment of the working class and impoverished in the United States, particularly within the realms of healthcare and workers' compensation. The solution lies in the implementation of minimum federal standards and the establishment of a new National Workers' Compensation Commission. Historical context and modern healthcare challenges. The Nazis' misuse of the medical system for eugenics purposes is a harrowing historical fact. In contrast, the contemporary U.S. healthcare system, while fundamentally different in intent and operation, faces criticism for how it can inadvertently perpetuate injustice, especially against the less privileged in personal healthcare, veteran services, Social Security disability insurance, and workers' compensation. Healthcare evolution and accountability issues. The rise of health maintenance organizations and increased legal protections for medical professionals in the U.S. have led to significant changes in healthcare accountability. These changes, intended to reduce costs, have ironically limited patients' ability to seek legal redress for medical malpractice, especially for damages considered below a certain financial threshold. This shift has arguably reduced medical accountability, disproportionately affecting those of lower socioeconomic status. The decline of civil litigation and workers' rights over the past 2 decades, the ability to sue for medical malpractice has drastically reduced due to legal reforms and state medical board policies, often labeling smaller claims as frivolous. This situation has weakened a crucial check on medical authority, particularly affecting those who suffer from medical negligence in smaller, yet significant, cases. Additionally, in systems like SSDI, VA healthcare, and state workers' compensation programs, there are increasing concerns about accessibility and fairness. These concerns highlight the need for overarching federal standards and a National Workers' Compensation Commission to ensure uniform protection and equitable treatment for workers across all states. Proposing solutions, federal standards, and a national commission to combat these challenges, establishing minimum federal standards in workers' compensation and healthcare is essential. A new National Workers' Compensation Commission could play a critical role in standardizing and enforcing these standards, addressing disparities in treatment, compensation, and access to care. Conclusion: a unified approach for justice and equity. Drawing parallels to historical injustices underlines the urgent need for reform in the U.S. healthcare and workers' compensation systems. By advocating for federal standards and a new national focus on workers' compensation, the U.S. can make significant strides towards ending the indirect class warfare perpetuated through healthcare policies. The establishment of a National Workers' Compensation Commission and the reevaluation of frivolous lawsuits are crucial steps towards a more just and accountable system, reflecting society's commitment to treating all its members with dignity and fairness.